Good afternoon. My name is Carole. I am 57 years of age. I started getting hooded eyes at the age of around 30, progressively getting worse and worse, to the point where I would change my hairstyle to try and hide the hooded eyes. I had no confidence whatsoever. All I thought people could see was my hooded eyes. I started to ask questions in Turkey of a recommended surgeon because this is something you cannot take lightly. You have to go with recommendations. Baris got recommended to me 100%. I came along for a meeting. He was very self-explanatory, made it clear what he could do for me. He won't just do the procedure because he thinks, okay, I can just do this. If you don't need the procedure, he will not do it. He has to be sure that it's right for both you and him. When I got shown the photograph of my after surgery, I cried. I hadn't seen my eyelids since I was 31. It was very emotional to wear eyeshadow for the first time in a long time. I will be forever, ever grateful to Dr. Baris for doing this for me. I recommend anyone to have this surgery. Please come along to Dr. Baris and Fethiye and have this surgery. You look in the mirror with confidence. Don't get me wrong, I don't walk around thinking, oh, I'm so beautiful. But just to look in the mirror and not see those hooded eyes is perfect. So come along, please get it done.
Hey guys again. Okay, so I have just finished the surgery. So as I told you, the hooded eye is not a big problem. Yes, of course I know for your life, for your matter of your life is big situation, it's a big problem, but for us it's not. And I believe all my patients, when they come to me to correct their, want me to correct their hooded eye, they always think about it, it's going to be heart surgery, it's going to be a hard situation. But believe me, all my patients says the same thing. They always say they were expecting too much things, but it's not. Believe me, you just feel 3-4 seconds when I inject the local anesthetic, and local anesthetic will be injected by myself, and I'm going to use a needle which needle that I am using is when I'm applying the Botox, the same needle that I use. That means like it's so tiny, and I believe it's the tiniest needle in the world, and that's why you don't feel anything about that. To be honest, yes, of course you're going to feel like 3-4 seconds discomfort, and after that you're not going to feel anything about this. And at the same time, the surgery, as I told you, can be done under local anesthesia. And for this time, our patient want us to open a playlist from Deacon Blue, which is a Scottish band, and she's Scottish as well. And we were listening that music, and she was so comfortable, and everything was good. Don't you think that?
Absolutely perfect. If you're thinking about having this done, you've got to come here. Absolutely brilliant. Thank you.
Thank you. See you in the next operation. Bye bye.
Oh wow. actually got like this bit. I
Yeah.
can see it.
Yeah.
I'm gonna cry
No,
now.
no, don't cry. Please don't cry.
I haven't looked like this since maybe my 30s. Thank you so much. Oh, wow.
Looks fabulous.
Can't believe it. I used to try these things from China. They were shaped like this,
Yeah.
and you stick them and try and lift up. I used to try to use them, but they don't work.
You don't have to use them anymore.
No. Wow.
And it's still even swollen. When the swelling goes down, when the swelling will be down,
Yes.
you will be more pleased. Looks fab.
Just need to get my eyebrows
Yes.
done again. Thank you so
You're
much.
welcome. You're welcome.
Oh.
So we're not gonna.